When developing training for certified euthanasia technicians, which adult learning principle is most important to ensure engagement during hands-on skill sessions? A. Rote memorization of protocols. B. Passive listening to lectures. C. Experiential and reflective learning. D. Strict adherence to written manuals. 2. During curriculum design for euthanasia procedures, which component ensures that learners demonstrate both technical skill and ethical reasoning? A. Multiple choice exams only. B. Skills checklists with ethical scenarios. C. Verbal recall of procedures. D. Group discussions without evaluation. 3. Which evaluation method best measures a technician's ability to perform euthanasia procedures humanely and confidently? A. Written multiple choice test. B. Peer assessment of teamwork. C. Direct observation with performance rubric. Open book exam. 4. In an adult learning environment, feedback to euthanasia trainees should be A. Delayed until after the course ends. B. Immediate, specific, and behavior-focused. C. General and motivational only. D. Avoided to reduce stress. 5. A euthanasia technician demonstrates anxiety during training. The instructor's best mentoring approach is to A. Ignore the behavior and continue. Offer constructive support and guided repetition. C. Penalize the trainee for emotional response. Skip skill evaluation. 6. Which communication strategy is most effective when explaining euthanasia consent procedures to clients? A. Using technical terminology. B. Providing clear, empathetic, and concise explanations. C. Limiting details to reduce questions. D. Delegating all explanations to another staff member. 7. Regulatory compliance for euthanasia technicians primarily ensures A. Efficient scheduling of euthanasia. B. Legal, ethical, and humane animal treatment. C. Faster turnaround in clinical operations. D. Reduced training time for staff. 8. Which component of euthanasia technician training best reinforces retention of humane handling techniques? A. One-time lecture. B. Periodic simulation and debriefing. C. Video-based demonstration only. D. Unsupervised practice sessions. 9. In adult learning, self-directed learners benefit most when instructors A. Dictate all learning steps. B. Encourage reflection and independent goal setting. C. Provide minimal resources. D. Focus on memorization drills. 10. When developing test questions for euthanasia technician certification, validity ensures that A. Questions are easy to answer. B. Tests measure intended competencies. C. Scores are consistent regardless of skill level. D. Tests are short and efficient. 11. An effective way to assess comprehension of legal documentation procedures is A. Oral questioning about theory. B. Role-playing client interactions. C. Written definitions of laws. D. Group brainstorming sessions. 12. In evaluating curriculum effectiveness, which indicator shows successful learning transfer? A. High attendance rates. B. Trainee application of learned skills in real settings. C. Instructor satisfaction scores. D. Number of course materials printed. 13. Mentoring a new euthanasia technician should prioritize A. Emotional resilience and technical proficiency. Memorization of policy documents. C. Independent performance without feedback. D. Limiting interpersonal communication. 14. The most ethical way to approach an animal owner reluctant about euthanasia is to A. Convince them quickly. B. Provide transparent information and emotional support. C. Avoid discussion of emotional aspects. D. Delegate the conversation. 15. The purpose of standard operating procedures (SOPs) in euthanasia training is to A. Eliminate all human decision-making. B. Provide uniform, compliant, and humane practices. C. Allow flexibility for untrained methods. D. Focus only on efficiency. 16. Which of the following aligns with adult learning theory? A. Adults prefer passive lectures. B. Adults bring prior experience that informs learning. Adults avoid peer discussion. D. Adults rely on instructor authority exclusively. 17. When a euthanasia technician trainee struggles with injection accuracy, the best instructor response is to A. Repeat demonstrations and supervise practice. B. Assign additional reading. C. Move to a new topic. D. Reprimand the trainee. 18. A reliable evaluation tool in euthanasia technician certification should A. Produce consistent results across evaluators. B. Change based on trainer opinion. C. Measure random variables. D. Focus on subjective interpretation. 19. Which law primarily governs euthanasia technician conduct in most jurisdictions? A. Controlled Substances Act. B. Veterinary Practice Act. C. Animal Welfare Act. D. OSHA Compliance Act. 20. Which communication method best demonstrates professionalism when discussing euthanasia with colleagues? Objective, respectful language. Casual tone. Emotional venting. D. Technical jargon only. 21. Reflective journaling in euthanasia training helps technicians to A. Memorize procedures. B. Develop emotional awareness and ethical reasoning. C. Replace technical assessments. D. Reduce feedback sessions. 22. During curriculum development, measurable objectives should A. Describe broad goals without outcomes. B. Define observable learner performance. C. Focus only on instructor expectations. D. Exclude ethical considerations. 23. When performing euthanasia, a technician must confirm death by A. Absence of heartbeat and respiration. Color change in skin. C. Rigid body posture. D. Expired drug date. 24. Which element ensures legal record-keeping compliance after euthanasia? A. Accurate completion and storage of records. B. Disposing of paperwork immediately. C. Minimal documentation. D. Unverified digital entry. 25. In training assessments, formative evaluation is used to A. Grade final performance only. B. Provide ongoing feedback to improve learning. C. Replace summative testing. D. Delay feedback. 26. To mentor effectively, a senior euthanasia technician should A. Demonstrate empathy and model ethical conduct. B. Emphasize authority and hierarchy. C. Focus only on errors. D. Limit communication to technical steps. 27. Cultural sensitivity in euthanasia communication is important because A. It ensures compliance with diversity policies. B. It fosters trust and respect with clients. C. It simplifies consent forms. D. It reduces documentation requirements. 28. Which is the best indicator of mastery in euthanasia training? A. Ability to explain the process theoretically. B. Consistent, humane, and compliant performance. Memorization of all drug names. D. Speed of task completion. 29. In adult learning, active participation increases when A. Trainees share control of learning activities. B. Lectures dominate the session. C. Learners are passive observers. D. Feedback is withheld. 30. An evaluation rubric for euthanasia skills must include A. Behavioral, ethical, and technical criteria. B. Only technical accuracy. C. Subjective instructor feelings. D. Speed-based performance. 31. Ethical euthanasia training emphasizes A. Minimizing animal distress and ensuring dignity. B. Efficiency and profit. C. Avoiding emotional discussions. D. Limiting client involvement. 32. When revising euthanasia training curriculum, the first step is to A. Review feedback and assessment data. Add new visuals. C. Shorten course duration. Reduce assessments. 33. A post-training debrief is effective because it A. Reinforces learning through reflection and dialogue. B. Reduces accountability. C. Eliminates emotional discussion. D. Focuses solely on errors. 34. Communication breakdowns during euthanasia procedures most often result from A. Unclear delegation and assumptions. Overdocumentation. Client familiarity. D. Staff overtraining. 35. The main ethical concern during mass euthanasia events is A. Efficiency. B. Maintaining humane standards under pressure. Speed of performance. D. Cost minimization. 36. An adult learner's motivation to master euthanasia skills increases when A. Learning is relevant to real-world tasks. B. Training is purely theoretical. C. Feedback is limited. D. The instructor dominates discussion. 37. The use of case studies in euthanasia training primarily supports A. Critical thinking and ethical decision-making. B. Memorization of drug protocols. C. Superficial understanding. D. Instructor-centered teaching. 38. Which mentoring approach builds long-term competence in euthanasia technicians? A. Coaching with reflection and self-assessment. B. Assigning repetitive drills. C. Limiting autonomy. D. Avoiding emotional support. 39. When conducting summative assessments, instructors should ensure A. Alignment with course objectives and ethical standards. B. Focus on easy scoring methods. C. Randomize questions unrelated to content. D. Subjective grading. 40. To maintain certification, euthanasia technicians must A. Engage in continuing education and compliance reviews. B. Rely solely on initial training. C. Skip recertification processes. D. Avoid performance audits.